have an impact, and at the end of the day they don't. Small steps will get them in the right direction, and they just need the guidance and the encouragement.
That was one of the stages of preparation for me in coming up with 3 absolutely critical message points for everybody, all of you at home watching. Is we've become, many of us, conditioned to the notion that dieting is painful, dieting is awful, and you're only going to lose in the end anyway, you're going to gain it all back, and so on. But Dr. Stahl has hammered home the point for me, as I think you just did, that what we're messaging to people tonight is these are modest changes over time. Modest changes over time can give you your life back. Fair enough?
Fair enough.
Okay. Let's go to Diane Ross. Diane, you're a registered nurse.
Yes.
And I think you had a question.
Yes, I did. I would like to address my first question to Donna Scott. This is a 2-part question. When you were talking before, I was wondering about meal substitutes such as Slim Fast or Carnation Instant Breakfast and over-the-counter appetite suppressants. What are your feelings on those?
Meal supplements are fine in the event that you don't have another alternative. If you are pre-planning your day out and you know that you will not have time to have a 10-minute sit-down meal supplement is fine. Part B of that, look at the kind of meal supplement, because if your meal supplement has 20 to 40 grams of sugar in it, what are you really doing for yourself? You're better off getting the soda and adding some egg white protein to it or something, but as an extreme. But basically, that supplement that is just a calorie replacement, if the nutritional breakdown is higher in sugar than what you would normally eat, it's actually setting you up to fail. So it's not a help. And then your second part of your question was?
Over-the-counter appetite suppressants. Do you have any feelings on those?
Yes.
That's what I'm asking.
Obviously, the apprehension leads you to believe. There are many ways to curb your appetite without doing it through. A lot of those appetite suppressants do not have a lot of data and a lot of study and a lot of science behind it. As you know, we're looking at what's good for us. You can still suppress your appetite by doing other little things, such as adding some lemon to some water and having some water before a meal, or putting a piece of sugarless chewing gum in your mouth while you have a craving. Those are things that will help. Appetite suppressants, I'm sorry, I don't support them from that. They don't have enough data behind them.
Okay.
And they're going to be more harmful than good.
And you have one more question.
I have one more question for Dr. Voice. Stress and obesity. What is the link between those two?
That's a great question, and I don't think there's going to be a direct answer for something like that. Part of the link would be the habits and behavioral aspect of when someone feels stressed, eating to excess or eating calorie-rich comfort foods. You'll hear that terminology fairly often. I think that's one. The other thing is that they unfortunately work together. They work in concert with one another, that obesity and stress increases the body's adrenaline levels to increase how fast your heart rate is, may increase blood pressure, and then potentially react for bad cardiac outcomes.
I want to remind the panel and the audience, of course the audience here can see the monitors. The title of our show is Northeastern Pennsylvania Dying Too Soon, One Meal at a Time. So let's not get too esoteric. I think we really get the audience's attention with that title. So I really want to focus, if you will help me here, do this for our audience. We're saying that the way you eat, one meal at a time, is going to put you in the grave too early. So that's something we need to talk about. Now we're back to Ellie's life story. Ellie, you're Ellie Kosmark.
Yes, I am.
And you live again, where do you live?
In Taylor.
And you've just had open heart surgery.
Yes.
How long ago?
4 months.
4 months. I guess we could talk about that for a while, but we're not supposed to. All right, here's part 2 of your story. You have introduced us to yourself and some family history. Okay. And now we're having a conversation with you, I believe, just before you go into open heart surgery with Dr. Stahl. So let's take a look at this.
I, wasn't feeling good, went to the doctors, and when I had gone to him before that, and he suggested going to a program because of my family history and because my mother had been overweight and my dad was a big man, and all of us were kind of a little bit, not thin, we weren't thin people, and he said because of my family history, if I didn't get myself in tow at that time, that years down the road, you know, I had the potential for these problems, for obesity, for diabetes, for cardiac, you know, coronary artery disease. So I joined that program, lost a lot of weight. Felt good for a little while, and then I started feeling kind of lousy, and I went back to the doctors, and he suggested we run some blood work and stuff, and that's when I found out that I was diabetic. Not that I didn't take it serious. I saw what it did to other members of my family. But I thought that nothing would ever happen to me. Every stress test that I had has come back basically normal. But over the last few years, I did have a cardiac cath in 2003, and they told me that I had started with some coronary artery disease, but it was minimal, nothing that was critical. You know, they felt comfortable with medication, that they could treat me with medication, and that should help to, you know, keep it at bay. I had a second cardiac cath in 2005. At that point, they knew that the cardiac cath showed that the disease had progressed. They changed some of my medication around, and you know, said that they would just keep a close eye on it. And at that point, I was feeling okay. I was feeling a little bit funny, maybe not myself, but I was feeling okay. And then over the next couple years, I continued to go for stress tests, which continued to, you know, come back normal. But I had gotten to the point where when I was working here at the CMC, and I would park on the side street, and I would walk roughly a block and a half. And by the time I got up to Colfax Avenue from where my car was parked, I would have to stop. And just, I would feel lightheaded. I'd have to wait until I didn't feel that way. Wait until I didn't feel like my legs were going to go out from under me. I would wait to catch my breath. I went to the doctors and complained again and told him that, you know, I feel exhausted. So he said that he would not do another stress test. He said he wouldn't put me back on the treadmill. He said with checking everything, going back to what had happened in the past and that, he felt that the best course of action to be would be just to do another cardiac cath. I really thought that my doctor was going to come over and tell me that they probably had to do a little angioplasty and maybe put a stent in or whatever, but instead he told me that he had to put in for a consult with Dr. Stahl because of the blockages, and he said they were to a critical point, and he figured that the best course of action would be for me to have the bypass surgery. I'm very nervous, but I also know that Dr. Stahl is great. He operated on my sister, he operated on my brother-in-law, and they are both wonderful, and I know he's going to do that for me. And I'm going to get on track, and I'm going to take care of myself again. And Dr. Stahl is going to make me do it. And I will do it for him. He just convinced me that I should.
Boy. Well, we'll have to get back to Dr. Stahl for comment, editorial comment on the video. And we have to get to Ellie again. And by the way, there's a third part to that video in the story of Ellie Kosmark. It's a great story. I have a couple of other folks here, and even I'm not entirely sure what I'm supposed to do with this. I started out with one gentleman, and then somebody brought me another one. Let's start with you. John, tell us who you are and why you raised your hand to talk.
Okay, well, my name is John Marsico. I'm the program coordinator for the Cardiology Fellowship at the Wright Center for Graduate Medical Education. And the reason I raised my hand and had a question about the relevance, all due to the relevance of this program, I personally recently went for blood work. I'm a 46-year-old male, went for blood work, and it came back with a fasting blood sugar of 121.
Okay, translate. I need some translation of this.
My understanding of that is it should be less than 100, so I'm in a pre-diabetic stage as of right now, and I had low good cholesterol and high triglycerides, which I was then told by my family doctor that I'm on a crash course for diabetes. So I'm also going for an obstructive sleep apnea sleep test next Friday. So all of this really hit home to me, and basically what I was told to do was to lose 10 to 20 pounds because my body mass index is right about 33 right now.
And when did this happen to you?
Within the last 2 weeks.
So it's fresh.
Yeah.
I'm told that Mr. Lipid is to my right here. Can we define, I guess I'm supposed to talk to you about his lipids? What are they,
apparently.
and why are you here?
Well,
you are Dr. Fitzpatrick.